Lysergic acid diethylamide, or LSD, is a synthetically produced psychoactive drug invented in 1938 by Swiss chemist Albert Hofmann. Although it is perhaps better known for its recreational use as a hallucinogen, LSD has also been utilized as a therapeutic drug for treatment of depression, anxiety and alcoholism. Typical symptoms of LSD include sensory hallucinations, perceptual alterations, emotional changes and a heightened sense of connection with one's surroundings. There are no known cases of fatal LSD overdose. However, there have been several fatal accidents that were related to the use of the drug, which eventually resulted in LSD being criminalized in several countries, including the United States and the United Kingdom, in the 1960s. As a result, research on its therapeutic uses faced a halt over the following decades. In the DSM-IV, alcoholism, or alcoholic abuse, is diagnosed as a recurrent and persistent use of alcohol resulting in inability to fulfill major obligations at work and home, recurrent social and interpersonal problems and legal problems related to alcohol use. Contemporary methods for the treatment of alcohol abuse include different drug treatments and forms of counseling and therapy. According to a report by the World Health Organization in 2011, there were over 25 million annual deaths caused by the harmful use of alcohol. With a research conducted in 1961, MacLean and colleagues set out to study whether LSD could be used as a therapeutic drug to treat alcoholism. The researchers hypothesized based on previous research that a single overwhelming psychedelic experience can help patients rid of their unhealthy drinking habits. Unlike common drug treatment, which aims to correct biochemical imbalances in the patient, the researchers suggested that LSD functions as a facilitator of self-appraisal that will help patients identify the underlying causes of their substance abuse. The study was conducted on 61 alcoholics and 39 patients with other mental disorders. The 61 alcoholics were selected from a total of 492 patients that had been admitted to the Hollywood Hospital for alcohol intoxication over a period of 18 months preceding the study. In general, the researchers considered the patients to be suffering from severe forms of alcohol abuse. At the first stage of the study, the participants are asked to write down a brief autobiography relating to their alcohol use upon admittance to the hospital. The researchers suggested that this process helps the participants identify aspects of their personality that would not necessarily surface otherwise. Moreover, the therapists also derive a concise psychiatric history from the autobiographies that help them rid of barriers for a constructive LSD experience. The participants submitted their autobiographies to the therapists 2 days prior to their LSD therapy. The psychedelic therapy itself was conducted in the presence of a support group consisting of 4 other people who ideally represent different facets of the participant's personality. Generally, the supporting group consisted of a therapist, a psychologist, a psychiatric nurse and a music therapist. According to the researchers, in an ideal setting the group consisted of 2 male and 2 female members, all of whom have had a prior successful psychedelic experience with LSD. They stated that the group members are unable to provide the participant with the support they need unless they have first-hand knowledge of the experience. Regarding the setting where the LSD therapy took place, the researchers were very particular to ensure a non-distracting, comfortable environment. The therapy was conducted in a quiet room with harmonious decoration room that composed of various universal symbols and a lack of technical equipment. The participants were administered a dose of 400 to 1500 gamma depending on the psychiatric appraisal of their defense mechanism. The underlying principle of dosage was that the closer the participant is to self-acceptance, the less the dosage required. The dosage was altered during the session if a desired psychedelic experience was not achieved. The dose was received orally, mixed in a glass of water.
Created using Powtoon.